one started in 1998. It was felt that there were a lot of people going to the dentist, finding things in their mouth that they were unsure of. Dentists were unsure whether or not they wanted to treat these anomalies that were there, and so the British Dental Health Foundation, as it was called at that time, decided that Mouth Cancer Action Week, as it was then, would be a very good thing to put the information out for both patients and for dentists. It was very successful as the week, but we felt that if we gave it a month, it would give people more time to assimilate the information, we'd be able to get it out to more people, and we also found that the practices became very engaged with it and started doing their own little posters, etc. within the practices and became very engaged in it. I think when people are brushing their teeth, looking after their teeth in the morning and in the evening, which they should be doing, they should also be looking to see whether or not they've got any ulcers that may have been there for quite a while. You usually know because you can feel an ulcer with your tongue and when you're speaking. Particularly if it's not painful, because ulcers tend to be a little painful. When they're not painful, sometimes that can show a warning sign that maybe it needs looking at. It may also be that you might get a white patch or a red patch somewhere in your mouth, up on the palate, on your tongue. And if it's been there for a while and it's not moving, again, it needs to be looked at. And the third thing that people can look for is they may get a lump in their mouth. Sometimes it does show as a lump, does cancer in the mouth as it does in other places within the body. And again, it needs to be looked at. 90% of these things that are usually looked at by the dentist turn out to be benign, something that can be treated with antibiotics or other medication, but it's better to be safe than sorry. If in doubt, get it checked out. Most people are aware that it is lifestyle that can cause mouth cancer, particularly heavy smoking, which fortunately people are not heavy smoking as much today as they used to be, but it can have an effect, particularly if you've been smoking for the last 20 years. It also, excessive drinking alcohol, that can cause a problem within it. We do try to say to people, moderation is the word that you should use with alcohol, not just for cancer, but for your lifestyle as well. And the third thing is HPV, which is usually contacted if you've had several partners or through oral sex. And we are trying to educate young people at the moment to try and keep these things to a minimum. Again, moderation in all things. Like all cancers, the screening is vitally important, and visiting the dentist regularly so that we can catch these things at an early stage. If we can catch them at an early stage, it means we can start the treatment as soon as possible. It will depend on the type of cancer, it will depend on the level that the cancer is in the mouth or on the lips, etc., as to what treatment will be required, whether or not it would need chemotherapy, radiotherapy, and whether or not it would need taking out. But if you keep up to your checkups, your 6 monthly checkups. You go to the dentist as soon as you feel that something is wrong. The earlier that we get you in that chair, the better it is for the patient, and the quicker we can deal with what's happening in the mouth.